Hello, in this video we will discuss about the kidney stones. So what is the kidney stone? The changes of homeostatic condition in the blood circulatory system and lead to formation of kidney stone. So in this video we will understand about the whole information about the kidney stone. So what is a renal stone or kidney stone? Let's begin to understand. So the kidney stone can cause pain, and here is the kidney which that contain upper part is the capsule, and this is the renal pyramid, and this is the major calyx, and this is the minor calyx, and this is the renal column are present, and this is the renal pyramid contain a medulla and cortex contain mostly glomerulus and Bowman capsule. So in this way, this is the ureter, which that is contain a stone. If so, it means the extra renal stone. While if the stone are present in the pelvis, so it means the renal stone, the kidney stone. So in this way, here is the genetic disorder also involved, dietary and lifestyle facts which that can cause the kidney stone. For example, eating the vegetables or other things, and on the other hand the acquired metabolic defects, for example the parathyroid hormone, the calcium increase in the blood, and also the phosphate increase in the blood will lead to cause also the kidney stone. And this is the basically the acquired metabolic defect and will lead to increase the initiating nidus will lead to cause the kidney stone. And this is the epithelium and the crystal form and stone formation by this mechanism. First is the initiating nidus will lead to cause the crystal form and stone. So the renal calcium cause blockage of the ureter at 3 millimeter. So in this way, the basically 3 millimeter diameter is required for the obstruction. So in this way, here is the amine group, a magnesium and phosphate and calcium when increase, and in this way when increase will lead to high pH, and in this way high pH due to the carbonate, phosphate and amine group, which that will lead to cause the mad stone formation in the ureter when the opening are in the pelvis. So the urine nanocrystallites which that will contain the magnesium, and here is the formula you can understand by the stopping the video to understand. So here is the imbalances. The reduced inhibitor will decrease while the increased stimulator will increase, will lead to cause the kidney stone. So let's begin to understand what is the decreasing reduced inhibitor which that will lead to cause kidney. So what is the increase the stimulator for production of the kidney stone? So the glycosaminoglycan, the chondroitin, sulfate, heparin, urinariprothrombin, and the fragment 1-time, horsefall protein, the magnesium, and diphosphonates, and the pyrophosphate, the hypocituria, citrate phytate, while the increase the stimulator when will rise in the blood and the reduced inhibitor will decrease. For example, the increased stimulator is the calciuria, uric acid, urate, phosphate, calcium oxalate, and urinary supersaturation, and the lactoferrin, the urate, lysozymes, the hyperoxaluria, phosphate urea, hyperuricuria, low urine volume. This will lead to cause the kidney stone when this imbalance, when increase the stimulator while the reduce the inhibitor. In this way, the imbalance will lead to cause the kidney stone. So let's begin to understand with the region wise the stone formation, and we will classify here. So this is the pelvis, which that is the renal pelvis contain asymptomatics no obstruction of urine flow. So the no obstruction from urine flow, and that is why the obstruction, and in this way the kidney contain pelvis which that will block due to this stone. So the background first we will discuss the occurs when there's an excess of crystal forming substances that can't be dissolved in urine, and the contributing factors like pH disturbance, low urine volume, and decrease the fluid intake. The decrease the fluid intake and dietary factors. These all things will lead to cause the pH disturbance, low urine volume, and fluid intake will lead to cause kidney stone. So here you can see this different picture to understand this kidney stone formation, and the structure is look like this. So remember, this structure is basically the yellowish color showing in the diagram figure, the picture to understand. But in this way, here is the in ureter. When the in ureter, the passing into the ureter, the pressure will increase, the spasm of smooth muscle lining, and the distension of wall and renal colic will lead to nausea and vomiting. On the other hand, the bladder, which that will lead to frequent painful urine due to the bladder containing the bladder stone, and the chronic discomfort, and the hydronephrosis, and the renal function decrease, and the pyelonephritis. So region wise it develop where the chances for the development of the stone will occur. So the types of stones can be a calcium oxalate, calcium phosphate, and the true white and uric acid. Most common is a calcium oxalate 70% and calcium phosphate also. So let's begin to understand the treatment. The treatment is required NSAIDs drug, and in fluid basically contain that fluid which that is comfortable for stone degradation and prevention to lead to normal homeostasis, and the medical expulsive therapy and the lithotripsy. So in this way, here the also the lithotripsy can be used to break down this stone to convert this sand. In this way, here is the basically the lithotripsy used to convert the sand of the stone to release into the urine. While the diagnosis is the X-ray and the non-contrast CT, ultrasound MRI, as well as the ureter endoscopy or urethral endoscopy. So in this way, here is I am drawing the structure to understand the ureter endoscopy, and this is will lead to get the camera to understand where is the kidney stone are present. For example, in the ureter or bladder or pelvis in the kidney. So let's begin to understand the stone formation. So what is the stone formation? That is basically we are understand as a summary formation how the stone will be formed. So the high calcium and the C2O4 and the phosphate, which that as well as the uric acid in urine, which there will be formation of the calcium phosphate and uric acid crystallites, which that will lead to calcium phosphate the basically to produce the crystallites attached to wax of the renal papilla. When go into the renal papilla, the heterogeneous nucleation of the cam on cap of or the uric acid, the crystallites, for example, the uric acid and the calcium oxalate monohydrates and the glycose aminoglycans, which that will be basically is the heterogeneous nucleation will lead to core formation of the calcium oxalate monohydrates and the calculi. So in this way, the low citrate and the gags will lead to successive deposition of organic matter and the crystals at core surface. In this way, the size increase and shell formation will lead to formation of the papillary calcium oxalate monohydrates calculi. In this way, the kidney stone formation will occur by this. So in this way, we have discussed about the kidney stone, the stone formation and the type of stone, treatment and diagnosis. So please make sure to subscribe, like and share, and also give the comment below, and please make sure to subscribe, and thanks for watching. So next video we will understand about also the glomerulonephritis and the other kidney disease, but in this way we had discussed about the kidney stone. So thanks for watching. Bye.